Zepbound, one of the popular drugs used for weight loss, is now getting FDA approval to treat another common health ailment. This medication from Eli Lilly is primarily used to treat type 2 diabetes and obesity, but now it can also be prescribed to treat sleep apnea for adults. This marks the first prescription drug treatment for the disorder, which affects about 39 million adults in the United States alone. NBC News medical analyst Dr. Ven Gupta joins us now with more. So, Dr. Gupta, talk to us about this. This is pretty big news, right? How does Zepbound help treat sleep apnea? And what stood out to you in the research here?
Well, Ellison, this is one in a series of studies that's showing the just broad multidimensional impacts of these new weight loss drugs. And sleep apnea is just but one, the positive impacts. Really what's happening here is that people are losing body weight, and especially around, say, their neck and their upper mouth, which tends to be one of the causes of sleep apnea. Really, that upper part of your airway starts to collapse at night. But what we saw is Zepbound actually resulted in about 20% weight loss reduction. And really what we see in people that suffer from sleep apnea is a 50% reduction in their symptoms, almost to the point that 1 in 2 people don't have any sleep apnea symptoms at all after being on Zepbound for about 2 years. So that was a big deal.
So how was this treated before? In the past, was it just sort of wear a CPAP machine and be on your way? And in terms of symptoms, if people think, okay, maybe I actually do have sleep apnea, how do you know if you have it?
Well, on that last point first, usually it's daytime sleepiness. If you sleep with say a partner at your side, usually they're not also getting a good night of sleep because you're snoring all night, and so it's really easy to tell if somebody has sleep apnea or if they should be screened for it because of nighttime snoring or daytime sleepiness, and maybe if they're also overweight. In terms of how this was treated before, exactly to your point, Elson, it was an uncomfortable CPAP mask that about 1 in 2 people with sleep apnea don't even wear because it's so uncomfortable. By the way, 30% of Americans across the country, we estimate, have sleep apnea. It's just not diagnosed. So this is a big, big problem that can cause heart and lung issues if untreated. So the fact that now we have a medication that can treat this underlying problem without wearing that mask potentially, this is a huge new age of transformation, exciting for our patients.
How soon could people who suffer from sleep apnea possibly access this type of medication? And is this something that will likely be covered by insurance, or is that still to be determined?
I suspect it will. This is not the indications that insurance right now is covering Zepbound for, but it likely, if it passed this prologue, this will become a covered condition, I suspect sometime in 2025, meaning more people will have access to this medication for this specific condition. So I do think access will improve. Insurance coverage will follow as well.
All right, Dr. Ven Gupta, thank you. We appreciate it.